Hi everyone, welcome back to Iridology Fusion Teaching Pod number 9. Today I'd like to talk about how most iridologists are not using the sclera to validate their iris findings. And this is very important. This is another mistake that I see some of my students make, and then other iridologists as they get into practice. They don't refer back to the sclera. And I do believe that the sclera is very, very important for validating what we see in the iris and also for picking up some areas that may be coming along that the iris was not able to show us. So let's get into this and see what the sclera is going to tell us. Okay, as we know, the eye is a plethora of information. We can look in that iris and we see a lot of detail. I call it the story. It is a person's story. But how do we know if we're reading it right? Well, if we look to some other guidelines around the eye, we are going to be able to pinpoint exactly what we need to see and what we need to help our client with. So we've already started talking about earlier in some of the podcasts about the collarette and how the shape of the collarette and how it moves out into the body of the eye is going to show us more questions to ask about organs or body structures. We've also talked about how the body systems guide us in a way to strengthening the body. Okay, so we've determined that the client that we're working with in this series happens to be of polyglandular type. That gives us detail already. Just knowing that structure of the eye, that subtype, gives us indication to strengthen the glandular system of the body. We may need to detox that system. We may need to strengthen that system. But now let's look in the sclera, because that may just give us a little more information and confirm what we've already seen when we looked in the iris. So here is our client. This is her right eye. We can see from the arrows on the picture at the left, we have an indicator vessel going into the breast area. Well, we didn't talk about the breast when we looked at the iris photos. This is giving us some more indication of where to take our client and what to talk about. So we have a clear indicator vessel in the 9 o'clock position, and then we have another vessel that stems from that indicator vessel moving downward, forming a tangential vessel at this point. So now we're going to maybe ask questions about the right breast. When we look over in the 3 o'clock position in the nasal quadrant, we can see another arrow with small, tiny lines, very thin lines. This relates to the emotional breast. Brings up more questions, doesn't it? Just below, in the same quadrant, we see another vessel that is stretching down towards the back area. Now, I have circled on this picture the spine, the area of the spine, and that's going to tell us a little bit more about our client. So in questioning the client, when I ask her about the breast area, I ask her about the back and the spine. It was that time she told me that she had had a breast reduction. She had 4 children. All 4 children were breastfed. She felt like she was worn out. So she needed to improve her health by having this breast reduction. This in turn took a lot of weight off her back and shoulders. So I believe that what we are seeing is not an issue per se with the breast, it is recovery that we're seeing in this particular area. If we move our attention over to the right photo, still in the right eye, what we're noticing in that particular area where the vessel around the 7 o'clock area is, that's moving into the liver area, the right lobe of the liver. So that's telling us maybe we need to do a little bit of liver cleansing. Then we see the meandering vessel and around the between 5 o'clock and 6 o'clock position in the lower quadrant of the eye. That is moving into the kidney and adrenal area. That is an area that we've already talked about with our client. So there we have confirmation. In moving into the left iris and the left sclera, what we're seeing down low is another meandering vessel with a longer vessel attachment that looks like it's trying to become again tangential. This area that we see the primary vessel is going to be in the kidney and adrenal. Again, this is confirmation. The other vessel that stems and gets thinner as it goes more upward is going into the area of the sigmoid colon and also into the descending colon on the left side. That's where it is. It is also moving into the spleen. We see a very fine vessel just around the 4 o'clock position that almost looks like it's pointing directly into the spleen. When I asked about this, the client confirmed to me that after her surgery she became anemic, that this was quite common and she understood what was going on. In the right photo, we see another meandering vessel, and this is one that's a little brighter, a little thicker than some of the others that we've already seen. This particular vessel is moving into the parathyroid. So now this is opening up some new questions that we may want to talk to the client about concerning bone health. Because obviously the calcium is not being distributed properly, or the parathyroid gland would not be in this shape. We can also see a little bit of a wobbly fork down below that. It's a little thinner and it is opening up into the thyroid area, also into the back. So she's already confirmed with me that her back is feeling much better since the breast reduction. So I'm going to concentrate my efforts into helping her now with bone health. So the sclera just told us a little bit more about my client's story. So we've discussed some of the findings that we've already talked about with the client. She's confirmed those. That has given us validation. And when we look at the sclera, that gave us more validation. So some of the sclera markings are also offering more things to talk about, such as that parathyroid that we discussed. We can decide, if time prevails, to talk about it then or talk about it later. It may be another topic of discussion at our next iridology appointment. So in teaching pod number 10, we're going to talk about detox versus building body systems. This seems to be a lot of areas of question that come up in classes where students ask, how will I know if I should detox or if I should strengthen and build the body's systems? So we'll be discussing that in teaching pod number 10. Thanks for joining me. I really appreciate your attention.